Friuli Venezia Giulia's health system is strong but strained. Rising costs, aging populations, and staff shortages are forcing tough choices to prevent long-term declines, says Professor Roberto Di Linardo.
Our region, we have a good health system, but it is suffering, as in all our nation, for two principal problems. The first one is the increasing of the cost for also increasing of the age of the person, and on the second side also the decreasing of activeness for medical doctor and nursing. This is a big problem on which we need to work and on which our region is working maybe better than other region, but the system is sure in a position of difficult that we want to manage.